Hello everyone. In today's video, we will be discussing about the clavicle or the collarbone. Now, I will discuss all the bones in a very short way so that you can just say this in your exams and clearly pass through them. So first, we will say that this is clavicle or the collarbone and it is a modified long bone present in our body. Why it is modified? Because of some peculiarities. First, it is the only long bone that is horizontally placed. Second, it is the only long bone which has membranocartilaginous ossification. The whole of the clavicle except its medial end ossifies from the membrane, whereas the medial end ossifies from the cartilage. Third point, it is subcutaneous throughout. Fourth point, it has got two primary centers of ossification. And fifth point, it is the first bone to start its ossification between the 5th and the 6th month of intrauterine life and the last bone to complete its ossification. Now, coming to the anatomical position of the clavicle. It has got a medial end, it has got a lateral end, and it has got a S-shaped shaft. You can see that the medial end is quadrilateral in shape, whereas the lateral end is flattened from above downwards. So we will say that the quadrilateral shaped medial end faces medially. You can see this is quadrilateral shaped. Second point, we will say that the anterior surface is convex in the medial 2/3. If this is the medial 2/3, this is the lateral 1/3. So the anterior surface is convex in the medial 2/3. And last point, we will say that in the lateral 1/3, in the inferior surface, there is a conoid tubercle and a trapezoid ridge. Also, we can say that near the medial end, this is roughened because of the presence of a horizontal groove, as you can see. So these were the features to prove its anatomical position. Now, going a slight detailed version of the clavicle. First, the medial end or the sternal end. Why sternal end? Because it articulates with the sternum to form the sternoclavicular joint. Now, the lateral end is also called as the acromial end. Why acromial? Because it articulates with the acromion process of the scapula to form the acromioclavicular joint. Now, the S-shaped shaft. Coming to the S-shaped shaft. This is divided into a medial 2/3 and a lateral 1/3. Okay, the medial 2/3 is having a superior surface, an inferior surface, an anterior border and a posterior border. Okay, the inferior surface of the medial 2/3 is rough and it presents a horizontal groove. The anterior surface, as we said, that it is convex anteriorly and it is concave posteriorly. The lateral 1/3 is concave anteriorly and convex posteriorly. Also, it has got superior surface, inferior surface, anterior surface and a posterior surface. Now coming to the attachments of the muscles and the ligaments in the clavicle. Now, the anterior 2/3, there is the origin of the pectoralis major muscle. Okay. In the posterior 2/3, there is the origin of the sternohyoid muscle. In the superior surface, near its medial end, there is origin of the sternocleidomastoid muscle. And the inferior surface has three features. First, there is the presence of the horizontal longitudinal groove where the subclavius muscle is attached. Second, it has got a nutrient foramen, which is not seen in this specimen, but it has got a nutrient foramen. And also one ligament is attached, which is called as the costoclavicular ligament. Okay. Now coming to the lateral surface. Lateral surface, superior surface is subcutaneous. The inferior surface bears the conoid tubercle and a trapezoid ridge, giving this a roughened appearance, as you can see. From here arises the coracoclavicular ligament. From the coronoid tubercle arises the conoid part of the coracoclavicular ligament, and from the trapezoid ridge arises the trapezoid part of the coracoclavicular ligament. Okay. Now, in the anterior portion of the lateral 1/3, there is the origin of the deltoid muscle, and in the posterior aspect of the lateral 1/3, there is the insertion of the trapezius muscle. Now coming to the clinical aspect of the clavicle. The commonest site of fracture in the clavicle is the junction between the medial 2/3 and the lateral 1/3. This is the weakest site of the clavicle. Why this is the weakest site? We have two reasons for that. First, the two curvatures of the clavicle, medial 2/3 and anterior 1/3, meet at this point. And second, the transmission of forces occur from this side through the coracoclavicular ligament. Hence, this is the weakest side. So if there is a fracture in this position, that is the junction of the medial 2/3 and anterior 1/3, then the clavicle will be displaced laterally downwards. Why? Because in the lateral aspect there is only the origin of deltoid and the insertion of the trapezius. So the muscles over here cannot equilibrate with the strong muscular support in the medial 2/3 of the clavicle.